BioBalance Healthcast, episode 259, Orgasm and Ejaculation in Women.
BioBalance Healthcast features conversations about positive aging. Your hosts are Dr. Kathy Maupin, Medical Director of BioBalance Health and a leading expert in treating symptoms of aging, and Brett Newcomb, a licensed professional counselor.
In our most recent podcast, we talked about orgasms and ejaculation in men. And this week, we're going to change the focus and talk about orgasms and ejaculation in women. And I want to start with a term called anorgasmia. Some women report that they have never felt an orgasm. They may have been sexual for a long time, but they haven't had that experience. And I've had female clients that come to my office for counseling that will report they've been married 15, 20 years to the same guy that they love, but they've never had that experience that they read about or see in the movies, or nothing like that ever happens for them, that they have sex and then suddenly they're watching TV or something and it's like it just was over. You know,
it felt nice, but it's over. They don't have
the
resolution,
a crescendo or a resolution similar to what everybody expects culturally. And what we find with some of these women is that they don't have that because they have some trauma history that interferes with the process. And physiologically, they may be having orgasms, but the reality of that experience doesn't penetrate their mindset, so they don't know. And some of that is due to the way that they were abused or whatever the abuse was. Some of it, though, doesn't have anything to do with an abuse history at all. It has to do with a chemical imbalance, a hormonal imbalance in the system, which is where you come in with the treatments that you offer because you've had the same experience. These women come in and say, I've never been raped or I've never been molested, and yet I've never had an orgasm. Is it technique? Is it style? Is there something is it thinking about something, a fantasy? What can I do to try to accomplish that? And they'll often report, I'm not a very sexual person. I really don't want sex a lot. I will do it to be nice. I'll do it because you're supposed to, but I don't feel it. And then you do your magic and you get a phone call going, oh my God, the postman is in danger.
Well, really, their husbands are in danger, their partners are in danger first, and then
exactly.
Everybody else is in danger for about a month.
So let's start there. Because that's a very common experience
but that's sexual desire.
Yeah.
So that oftentimes when people who are anorgasmic are also not their desire is not on a very high level. In general, when we look at their past, it is one of often very devoted men who have tried everything that they know of to help their wives or their partners have an orgasm or to get the same thing out of sex that they do. Right. So it's not their partners. We've talked at length about that. But when we look at their blood work, they have very low testosterone levels at almost any age. And I often see people who are in their late 30s who have very low testosterone. Now, I don't see people who are going to have more children in late 30s, but those who have completed childbearing who have always had low testosterone. When I ask them, have you ever had a big sex drive? Have you ever, wanted to have sex except that your partner wanted to have sex? And they say no, that they just never felt very, very sexy, very sexual. They never were looking for anything like that in a relationship. Then when we give them back their testosterone, or we give them a reasonable amount of testosterone, let me interject that everyone has the hormone level or the testosterone level that was genetically made for them, but it does not always make them sexual. Sometimes their genetically normal testosterone level is low. So we try to bring them back to what we consider kind of average testosterone level, and they finally feel it. It is a chemical thing. It is not always a psychological thing or a couple thing. It is often a chemical thing where now they have sexual desire. Now they enjoy sex more because the testosterone is stimulating the nerves of the pelvis and giving them the neurotransmitters to push their oxytocin and have them have an orgasm, and they come in and say, this is something I've never had before, and it is so wonderful, and my husband's so happy that I finally have experienced this and are experiencing it on an ongoing basis, and all it was a hormone.
Right. You were saying as we were prepping for doing our research for this conversation that one of the things that you have to explain to people, and it takes some time, is that we can measure testosterone in the blood. And so we can get what your testosterone level is or what your normal is, but it does its work within the cell. And there's competition among hormones for access to the work mechanisms of
The receptor
that cell. And so not everybody's volume works the same way in everybody's body.
Right. So
And
you may have
to
a high
find out
level,
yeah.
but your body's resistant to it. So it looks great on paper, but you're not feeling it. You need more, or you need to be sensitized.
Well, the reason that matters is
to that.
other physicians, when people go, because you're a specialist and they come to you for the specialty work and they go back to their regular doctor, sometimes their regular doctor will look at their blood work and go, oh my God, this is abnormal, or this is not right.
I usually find out when they don't come back because they've been scared by their primary care.
Right.
They feel great. Everything's working fine. They don't have side effects, but their primary care doctor scared them to death.
Yeah.
And usually based on their total testosterone level, which is not even important because it's invisible. Most of that is invisible to your body. It's just a tiny portion of it, and that's what I'm interested in, the free testosterone level.
Most of the total testosterone passes through your body and is
It's bound
excreted
up,
out.
and it's bound
Yeah.
up. And it doesn't, it's not available. So your body doesn't even see it. So their premise is wrong. It's not their fault personally. They were trained that way. No one cares to know much about testosterone in women. So they don't. I mean, there's lots of research. They always go, there's no research. There's tons of research. And it is sad that they will scare people so that they can't have a normal sex life anymore because they're too scared to come back. They don't tell them what's going to happen to them because nothing is going to happen to them. Nothing bad.
So we're talking about the anorgasmia and the ability to correct that with testosterone.
Right.
So as we move into the question of orgasm for women who now have the ability to have an orgasm or were never impeded in their ability to have orgasm. In the research that we have done, there are different conversations about the question, for instance, can a woman be multi-orgasmic? And does that mean she can have 1, 2, 3, 10 orgasms in a single sexual encounter, discrete and separate? Or does it mean she has multiple locations of orgasmic concentration? And so maybe you can speak to that.
You can have multiple orgasms from the same, if you're stimulated in one place, you can have multiple orgasms from that one stimulation, like if it's from the clitoris or if it's from the G-spot. So let me go back. If you're looking at a woman on her back, like gynecologists do, the clitoris is on top. Most women don't know this, most men do. Clitoris is on top, then the urethra where you urinate from, and then the vagina, and then the rectum. So it kind of goes in that order just to give us an idea. So if the clitoris is being stimulated, most women have the ability to do this. Many women hold back and won't do it, but many women can, if given the chance and enough stimulation, long enough stimulation, they can have multiple orgasms without much time in between. So they can have an orgasm and then they can continue to have sex and then have another orgasm, and then there are also women who have like pre-orgasms and they consider this one orgasm, but basically they have pleasure episodes until they reach the climax.
Right.
So that's
sort of an additive or building intensity.
Right, but that's they don't call that a multiple orgasm, but I call it a multiple orgasm because they're experiencing waves of pleasure and waves, and their brain is lighting up every time they're having these slight peaks until they reach the final peak. If you had an EKG machine,
you could register and say, well, that hit the intensity level.
Right. And so we could look at that. So that women have the capacity to do that if they have all of their hormones, both estrogen and testosterone. And for those of you who can't take estrogen, testosterone works very well, and some people can be multi-orgasmic on just testosterone, but it works better when you have both hormones. And there's lots of different physiologic reasons for that, but it really does. And that's something that shouldn't slow you down, but should at least be let you know that it may not be quite like you were 30
So
if you don't have the estrogen
I
portion.
had a couple that I worked with for a while who were having communication issues and understanding issues because of what they defined as a sexual problem. And their sexual problem was that this woman was only able to have a clitorally stimulated orgasm.
Mm-hmm.
And they tried to have regular penetrative sex.
Mm-hmm.
And the man would have an orgasm, but the woman would not. And
Mm-hmm.
they were disappointed and upset. And they kept thinking, well, if we really love each other, we really desire each other, blah, blah, blah. What we found out was that the woman had had a hysterectomy and they had taken out the cervix.
Mm-hmm.
And she didn't have that capacity physiologically.
She didn't have the nerves
nerve
that
bundle
go
at
to
back
the
of
cervix.
Yes,
So there are cervical orgasms
right.
that come from the cervix, which is at the very top of the vagina, which when penetration occurs and the cervix is pushed or moved by the penis or fingers.
It strokes it, it stimulates it.
It stimulates it, and that can create a different type of orgasm, a different feeling than if you have clitoral stimulation. Most women have orgasms by clitoral stimulation.
Right.
It's the most obvious because it's the easiest to get to. Not everyone has cervical or penetration orgasms, but that is from a specific bundle of nerves. There's another area called the G spot, which is, once again, if a woman was on her back in lithotomy position, like at the gynecologist, it's right under the bladder. It's in the vagina and about that far up. It usually feels like a bump of tissue. And that is actually a nerve bundle that can be stimulated and cause an orgasm. And then you can also have orgasms from stimulation around the vagina, around the labia, and around that area, and also around the rectum. So orgasms can be from any of these stimulatory areas. Everyone that has these different orgasms or has all of them describe them differently. They feel different. But in addition to this, my patients will come in and they'll say, and this weird thing's happening, and I think I'm like peeing on myself, and I don't want to do that when I'm having intercourse, and they're embarrassed and they don't want to even tell me. Or they say, oh, I want to tell you something, I can't tell you. And then I say, so are you now having ejaculatory orgasms? And they're like, is that what that is?
Mm-hmm.
So
Well, no, they're more like women can't do that. That's what men do.
right.
And they don't know that women
and they
can
feel
do
like
that.
that's something wrong that they're doing, or they are doing, or something's wrong with their hormones, or something's wrong with them. They shouldn't be doing this. But in my conversations with these people, it's a matter of comfort and a matter of realizing that this is a normal function.
Normalizing. So
for
important.
For many women.
For them and for their partners. For their partner
Right.
to know that's normal, something bad didn't just happen.
Right. And the most common stimulation, if there's stimulation of the area of the clitoris, oftentimes the ejaculation that will follow will actually look like urine, but it's not. It's not yellow. It doesn't have the smell of urine. It's not urine. It's an ejaculatory fluid that actually comes from periurethral glands right next to the urethra, but it comes through the urethra and it looks like you're urinating, but it actually is very sweet. It doesn't have the smell.
High sugar content.
And it's
blood sugar.
blood sugar content, and it has not sweet like
Yeah.
sweet, but it has sugar in it, and it also has kind of a slipperiness, like fatty acids are in it, so that it's quite different from urination. So that comes from clitoral stimulation. Then the G spot, which is that area that's in the vagina, but only a little bit. It's only a few inch or so in. That if that's stimulated, oftentimes the ejaculation will come through the periurethral glands, which are the two little openings on either side of the urethra. And then you can even get a forceful fluid that comes out of that. And that usually has a different feeling to women who have that. They don't tend to be so worried about urine, but